Hey, this is Matt Urtz, the Madison County historian. We are still working to document uh, how the COVID-19 pandemic has impacted different people, businesses, and organizations. Today we have Eric Faisst, the director of Madison County's Public Health Office. Eric, thanks for being here today. Talk a little bit about, for those that aren't familiar, what does the Public Health Office actually kind of do and oversee?
Sure. Thanks, Matt. Public health, our work involves, is pretty much dictated by the state of New York's public health law. We run about 30 different programs that range from everything from trapping vector control, which would include mosquitoes and rabies and Lyme disease and ticks, to transportation and education of handicapped children, to disease surveillance, regulatory requirements for like food service inspections, campgrounds, beaches, and everything in between.
Okay. So talk a little bit about when COVID-19 first appeared on your radar and what kind of plans either were in place or did you put in place as it grew?
Sure. So in terms of when we first started hearing about COVID-19, we tended to hear about it like everyone else. It started appearing in the news early to mid-January, roughly around there. We started having kind of weekly conference calls, if you will, with the state health department. At that time, it was really saying, if it comes here, we need to be prepared. So it was those types of discussions, starting to look at existing plans that we already had in place. One of the things in terms of emergency preparedness for public health, ever since 9/11 occurred, we've had a required public health emergency preparedness component of our work. So yearly since 9/11, we've done trainings, we've done testings, tabletop exercises. So in many ways, we were probably as best prepared as we could be. Up until this point, our experience with pandemics were H1N1. We did go through SARS, MERS. We had that Ebola scare a couple years ago, but nothing on the scale that we've had here. Initially when we heard about it, we started dusting off our pandemic flu plans because that was the closest thing we had to something like that. That was helpful, but as you know from experiencing COVID-19, the information about this particular disease changed hourly, and so our plans and reaction did likewise.
And that kind of the next thing, when it kind of erupted, we talk about kind of between March 11th and March 20th, the first thing that kind of happens from an employee perspective is we go to half staff and then we're closing. And then, talk a little bit about that process. And you guys are literally on the fly having to track this, figure this out with information flying at you, some of which is probably good and some of which is less than good.
Yeah. We didn't lack for a wealth of information. What we lacked was good information. And we were getting information from every sources. I think social media became really a two-edged sword throughout this whole process. And I'll get into more about just the phenomena in my mind about data and information throughout this whole thing. But on the response side, we had a little bit of luxury, if you will, for lack of a better term, in that our first case occurred in March 22nd, 2020, which was several weeks after the first case appeared in New York State, which was down in New York City in Westchester County area. So we had a little bit of luxury, as I said, in terms of watching what happened there to add to our preparations. And I think because of that, plus we, as you know, with the county, the last couple of years, it really ramped up its emergency management capacity. And I think that was a blessing in disguise for me, at least. Up until this point, our type of emergency response has pretty much been contained within the health department. We never really had to step outside of our own capacity to respond to these emergencies. We had to coordinate things with the state, but we never really had to, it didn't expand beyond our our staffing capacity. This got beyond our capacity as a department probably within a week. It expanded so quickly. And the fact that we had the emergency management office and that we had some ongoing relationships with them and we're talking with them, we were able to open up that emergency response incident command system. And for those who may not be familiar with incident command, it has the ability to expand and collapse with the event. So by following that structure, we were able to expand rapidly. I mean, it was really rapid. Like I said, within a week, especially after we got our first positive on the 22nd, then it was chaos. It was 7 days a week, 12 to 15-hour days. And basically what happened to us for the health department was I have a staff of about 36 people right now. All but 3 became full-time in the response effort. So clerical support staff, we're now making phone calls to track potential exposed people for COVID. So their day jobs kind of went out the window and everything was response mode for us. But the key to it was really having emergency management that allowed us to expand, because if you understand the structure, there's like operations, logistics, planning, so forth, are components of the incident command structure. At one point, we were doing all of those functions, but quite quickly, within a week, we were just focused on operations, which was the isolation and quarantine and the contact tracing. And that became everything we did. We breathed it day in and day and night. That was our sole focus in it. And it has been recently up until about, I would say, to about a week or 2 ago.
So you talked about that kind of building. Talk a little bit about you start doing conferences in an effort to get information disseminated to people, and how successful that seemed to be initially. And then you kind of have the incident with Sunset Tomatoes, and that changes things, because then there's just a lot of information that's getting out there that's not necessarily accurate. So talk a little bit about that process and what happened.
Yeah, that was an interesting phenomenon. I mean, going back to the information in general, it was a phenomenon. It was absolutely incredible how many people wanted data on reports. I actually went and did some research through psychological literature, and there is evidence to suggest that in times of stress such as this, people have a craving for information. So it made sense. So we actually made getting information out a key priority right from the get-go. To me, there was kind of 3 major aspects of this response. One was, since there was no vaccine, there was no medical cure, the social interventions, the social distancing, the masking, and then the isolation and quarantine that was it. That was that was all we had to respond to this. The other main component was information, kind of trying to filter out all the information. Social media was a major problem because all the misinformation that was out there. And it takes time to kind of sort through all that and also compete against that in the public's eye. And then you also have an underlying, at least at this time in 2020, you have an underlying distrust for government, if you will, or thinking that the government's trying to hold something back. So you're fighting all those things on the information component. And then the third component of the response that was probably as challenging as anything else was coordinating the supplies that were needed to support the health response. So those are kind of the 3 main tracks that were kind of driving all of this. And they have a kind of a part to play when we get to the greenhouse or the Sunset Farms. our approach here was twofold. Our strategy was twofold: containment, which included the isolation and quarantine, and then outreach and education. And, getting people to understand you need to wear masks or face coverings, you need to social distance, and really getting people to change behavior in a way that's never been seen here in the United States, restricting people's freedoms. That's a challenging message, almost kind of like a martial law type of approach to taking to the people. So we knew that was going to be, so the messaging was a challenge. But on the public health strategy side, it's always been our intent, was key to identify who was positive or who had it and get them isolated and separated from the rest of the population as quickly as possible. Now, there were some initial challenges with that when this hit, and then it started spreading, and when it kind of took off in New York. There was protocols sent out and guidance by the state at who gets tested, but the providers were testing anybody and everybody. So we were starting to get inundated, not only with tests for individuals that really shouldn't have been tested or met the criteria, but then that overabundance of testing actually crippled our lab's ability to get the test results to us in a timely fashion. So we were at some point seeing a 2-week lag between when someone got tested and when we saw the results. So from a disease containment perspective, we wouldn't know about a positive case for 2 weeks. They were walking around spreading it. So we were always kind of behind from the get-go on this disease and trying to catch up. So one of our strategies was really trying to identify and get ahead of it wherever we could, try to identify where potential hotspots were and try to contain those as quickly as possible. So that's kind of led to the Sunset Greenhouse project, as well as with the Grand Nursing Home facility as well. And in terms of the Sunset Farm, our first case actually was an individual who worked at the greenhouse. That was the March 22nd case. We did our case investigation and we identified whoever they were exposed to, and we were able to get those quarantined and contained. And so over a month went by and we never saw another case associated with the greenhouse. It alerted us, or that case, however, alerted us to the fact, and that's when we found out about all these greenhouse workers being housed in neighboring hotels because the housing facilities that the greenhouse was building for them hadn't been completed yet and actually were on hold because of COVID-19. So we had probably the worst case scenario for a disease outbreak you could imagine is we had a lot of people in a small closed environment. So we were very concerned when we first found out about that. So we started working with the greenhouse people as well as the hotels to try to put as many practices in place to social distancing, so on and so forth, to limit the spread. So we were kind of in the monitoring that. It was on our board of worst case scenarios if something happens type of list. And so it was, and the other aspect that allowed us to respond to this was that we, because of our emergency management, setting up a unified command with emergency management, plus including the 2 hospitals, we had a morning call at 8:30 every morning with emergency management in the hospitals saying, okay, what are we seeing? What's happening? Going over kind of our strategies and our incident action plan. It was during one of these calls where the hospital said, we're seeing a number of these workers from the local Super 8 coming in to our ER, not feeling well and being, symptomatic and asking for testing. That, because we had those daily calls and because the hospital was observing that triggered us to say we need to test the greenhouse workers immediately, especially those living in the hotels, because it looks like we might have something here. That prompted us we coordinate that with the New York State Regional Office. We made that decision on Thursday. Saturday morning, we were at the greenhouse testing workers, and we did 2 testing days. We tested over 300 workers. What was surprising is that when we got the test results back, originally 82 of them tested positive out of the 120 that was in Madison County. And even more surprising was that one of the criteria for them to get tested, they couldn't have any symptoms, no fever, no shortness of breath. They had to be asymptomatic in order to be tested. So when we got 83 positives back of asymptomatic individuals, that was quite alarming. So that led us to immediately kind of basically, we had to quarantine and isolate them in place. That was kind of the biggest challenges, because in our rural community, most of our isolation and quarantine was keeping people in their homes.
Right.
Here they didn't have homes. The hotels were their homes. And our backup plan for people that couldn't be housed in their home was to house them in the hotel. So, and that was a challenge too, because the hotels initially didn't want to be that place for quarantining. Fine. We were fortunate that these guys were already in the hotels, because then we just quarantined the hotels and them in it. So it actually worked out to our benefit. It benefited us in many ways because they were all in one location. Now, we did have issues. There was 2 different languages that we had to translate and work with out of those 83 people, but they were extremely cooperative, extremely helpful. The short of it is that if you look at our numbers or cases before and after that, the cases, once we identified those 83 and there was like 1 to 2 cases a day after that. So in my opinion, we were successful in containing that. It doesn't look like it got outside the hotels.
Yeah, it seems like it's been a similar situation with the Grand.
Yeah, the Grand is similar in the sense that you have a congregate setting and you have a very vulnerable population. Now, the nursing homes, at least in Madison County, have traditionally, every year during flu season, they close to visitors for that very reason. So that to some extent, they were already closed for the flu for visitors, so that it helped them to some extent. Unfortunately, as we saw with the Grand, the only way it was going to get in is by a worker. And that's I believe that in this particular case in the Grand, actually, we think it got in because one of the residents had to go to dialysis. And at the dialysis center may have been exposed and brought it back. So, and then it just kind of took off once it got in there.
So talk about now we're down to, as of last night, I think 8 active cases. Like there's probably more, but
down to 7 now. Actually, we had 0 new cases today, so we're down to 7 active cases. So
talk about New York has been on a pretty significant downswing for a while, but we're seeing it now pop up further west, specifically some south, places like Texas and Florida.
Correct.
Is there a fear of this coming back, and what are we trying to do to? I mean, it seems like people are starting to get into that routine. We're in theory starting phase 3 tomorrow, which means phase 4 is possibly in 2 weeks, and I believe it's the last phase.
I'm sorry?
I believe that's the last phase.
Yes, phase 4 was the last phase that I'm aware of.
So how are you guys prepping for, I mean, and so much is so very much in the air. Colleges are trying to figure out, and schools are trying to figure out, how are we bringing people back?
Exactly.
What do we do if there's an outbreak? And everyone's kind of watching all these other things happen and going, all right, we're going to watch basketball when it comes back and see how they do. And we're going to watch this company and see how they do. How are you guys trying to prep, not only to stop it, but if it does happen again?
Yeah, in terms of our prep, like I mentioned earlier, is that we use that incident command structure. So we ramp up and ramp down. We're kind of ramping down right now. We're allowing people, because I still have what I'll call my day job. We still have all the programs, those 30-some programs that we run. Right. We still have to run them. So even in addition to COVID-19. While we're in this kind of a lull period, some of my staff is going back to its normal day job duties. But we already have, for example, contact tracers. We have 28 individuals trained. We have a cadre of Medical Reserve Corps volunteers that are ready to go. So if we need to ramp up, we can do this quite quickly. and rapidly. And since we've already done it, that would be quite easily to do it. And I think we have the capacity to do that. So we do anticipate another uptick in cases, probably especially this fall when we start getting into flu season. One of the things that we're doing actually starting next week is we're actually doing creating kind of a response plan for this coming fall in anticipation of flu, also adding to the complexity of COVID because the symptoms are very similar. And we're actually going to be doing an aggressive flu vaccination campaign, getting people to at least go get their flu shots because that is available. And that way we can eliminate or try to reduce the number of people that confuse the COVID issue by having flu and also keeping people out of the hospital. I mean, our whole strategy for isolation, quarantine, and the social distancing, the main purpose of this is to prevent our healthcare system from being inundated. That's really all it's for. And it helps us buy time until there's a vaccine, which is probably, hopefully, sometime next year. So the state's, perspective of this is that we're going until there's a vaccine in terms of pandemic response. And so right now we're at a lull. There seems to be some, as I mentioned earlier, we're learning something new every day. There seems to be some encouraging news about this might be coming seasonal like the flu, that the warmer weather does have an effect on it. And I think that's why you're starting to see the lag here. And so I hope that stays true. So it kind of gets us through the summer. So we're planning for the fall, but we're also, for example, this after this call, actually we have a joint call with the 3 colleges in Madison County to start talking about their plans for reopening. How are they going to reopen? Everything from testing students to staff, facility, isolation and quarantine, cleaning, and kind of what practices are they going to put into place to minimize or maintain social distancing, things like that.
That's interesting because the first case was tied to Colgate, wasn't it?
Well, the first case was actually there was a student in Colgate who lived in Illinois who tested positive in Illinois.
Okay.
But was traced back to here. Was it probably exposed here? In fact, we think the Colgate basketball game was the main exposure point. And if you think about that, that Colgate basketball game and the events in Hamilton, our first kind of blip was in Hamilton.
Yeah.
I think 30 out of the 36 first cases came from Hamilton. And we can trace that back to the events of that week when they had the college basketball game, had a lot of events in the town in the village at that time associated with the college, because if they would have won that game, they would have went to the NCAA tournament. They would have won their Federal League, whatever, championship.
Patriot League, yeah.
So there was a lot of things going on there. That was also the last week before the state closed everything down.
Right.
Which tells us that the disease was here way before we knew it, and it was already spreading. So so that's really where it was first, and then we had the greenhouse worker, and then everything kind of shifted north.
Yeah, and like I said, I've been doing these interviews. I actually talked to the dean of Colgate, and he was really interesting in that he said what a lot of teachers have said in these, and that is our students want to be on campus. This idea that they want to do distance learning is not true. And that presents a pretty big issue, because part of what is going to elementary school and high school and college is the social aspect. And right now we're trying to not avoid social aspect, but avoid close-up social aspect.
Right.
How does that work? Especially in a scenario, colleges specifically, you're bringing a ton of kids from outside the area, and we've seen it as football players specifically come back on campuses. You've seen these reports of 12 players have it, 6 players have it. None of them ever knew it. They were all asymptomatic. But it presents a question of what happens when that.
Yeah. I think that the protests that are going on are going to be really insightful in a couple of weeks
Yes.
in terms of that mass gathering type of concept.
Well, and we learned so much. There was an article today I read that 2 hairstylists had treated 140 people, and none of the 100.
None of them, yeah, I saw that same article.
Yeah, so it's such a fluid situation, and the best example I can give with these interviews is when we talked to superintendents, they were all about 3 weeks apart, and the first ones would only talk about the 2 weeks, and we'll be back to school soon. And the last one was real honest. He was like, I don't know how we're going to social distance bus. I don't know if we're going to do A or B days or A or B weeks. There's so much that's up in the air, and we can't answer right now.
Right. There's almost like two kind of, and then you also have conflicting information. Let me start with that, because if you look about the reopening of states, New York has a compelling argument for doing it well and doing it right. If you look at their data compared to other states, and then you have all these other states that apparently reopened too early, and you're seeing a spike in cases. And then you have some place like Georgia that's been reopened first, and they're not seeing that. So even the data doesn't necessarily justify or tell you which direction to go or what's working or what's not working. So that I find part of the challenge, yeah, I mean, I know common sense is a relative term, but but to some extent, it's going to come down to people whether or not they're going to social distance and wear a mask. There's nothing government's going to do. There's nothing even that colleges or universities or the facilities are going to do. It's going to come down to you and I making a conscious decision to practice these things what we've heard about until there's a vaccine or some type of medical treatment. I liken it to, it took a while, but when I was growing up, and I think still now, that you see the signs of no shoes, no shirts, no service.
Yeah.
You just add face coverings to that. It's just going to become commonplace. But at the same time, we have a lot of fears about what's going to happen next. And I do believe we're going to have another wave. If you look at historically at just the life of pandemics, they tend to come in 2 to 3 waves. So I believe there will be a second wave. So there is a concern about that. And then you have almost like the bookends in terms of concern. You have the people that are extremely worried, won't come out of their house, and we don't know when this is going to end. And then you have the people that are just totally burnout, and I'm done with this, and I've had enough, and I'm COVID burned out, and I don't care if it bothers me. I'm just going to go back to living normal. So it's going to be interesting.
I always called it the 20-60-20 rule. 20 will never leave their house again. 20 will go the instant they can go. What are the 60% in between going to do? Are they going to go out a little more? Are they going to go out a lot more? Where are they going to go? Are they going to take precautions? It's been an interesting experience to be part of. And I started initially trying to write about 1918. And one of the things that caught my attention is there was an article in October of 1918 in the Canastota newspaper about how the Spanish flu was created by the German army during World War I to try and kill off American soldiers. And this was an article written, and they were very, very serious. And I thought, boy, the misinformation that got out then.
Yeah.
As you go through and read about the Spanish flu, there's a lot of things, and it's been pretty well documented. I think Baltimore and Chicago had massive parades, and they told people, don't worry about wearing face masks. We're strong. We're going to be okay. And then they just got crushed by waves of that pandemic.
It's my understanding that the moniker Spanish flu is actually politically, it actually started, my understanding, it started here in the U.S. And
it did.
Labeled it that to divert. And you see the same thing here. It's like you see the governor saying, no, it's coming from Italy. It's like, it really doesn't matter. It could have been an American who was over there got it.
Well, and we're such a global world now that regardless of where it starts, if it's there's a pretty good chance it's going to get everywhere, because that's. Oh, yeah. I have a brother in Germany, and he talked about kind of how they did it different in the things they did. So it's been an interesting experience. I know you have a lot to do, so I want to thank you for taking the time to talk to me today.
You bet.
Is there anything else you'd like to say before you go?
No, I would just be interested to see what this looks like 100 years from now. But
Me too.
I won't be here to see it, but it'll be interesting to get the take on it, how history defines it.
I do too, and I think back to when we put the time capsule into the courthouse and we put a bottle of bourbon in that, and maybe about 40 years from now or so, we'll reopen that, we'll do a big renovation project, and we'll cheers to the surviving the pandemic of 2020.
Yeah.
Thank you, Eric.
Oh, thank you. I appreciate it, taking the time to do this.
Yeah, well, and you too, because like I said, I know this has been a very unique experience. We will talk to you soon.
Great, thanks. Take care.
Bye now.